Welcome to this edition of Dufferin Life. I'm your host, Teena Avery. Thank you so much for tuning in. So we're into the fall. With the fall comes lovely thoughts of the holiday season, skiing, winter getaways, but it also, what comes into effect is we're in a closer environment with a lot more people, and that brings us into cold and flu season and sometimes some respiratory issues. So today we're going to be talking about fall and winter respiratory issues, and I have three esteemed guests today, which I'm going to thank you so much for joining us.
Thanks for having us, Teena.
It is truly my pleasure. And Stephanie, we're going to start with you. I'm going to let each of you introduce yourselves and what your specialties are. So Stephanie, if you could let us know a little bit about you.
Absolutely. Hello, my name is Stephanie Colson, and I'm the project manager with the Hills of Headwaters Collaborative Ontario Health Team. And I'll pass it over to Matthew to introduce.
Thanks, Stephanie and Teena, and it's good being with all of you today. I'm Dr. Matthew Tenenbaum, and I'm the Associate Medical Officer of Health with Wellington Dufferin-Caledon Public Health. Alex, I'll hand it over to you next.
Thank you. Thank you for having me. My name is Alex Kushevich. I'm the infection control practitioner, so I would be the lead contact here at Headwaters Healthcare Center.
Well, thank you all three for joining me. And I've got all the experts on the line for us today. And let's talk a little bit about, with these colder weather arriving, how it affects our risk for illness.
I'm happy to speak to that. We know from other things that we have often dealt with and dealt with for years, like colds and flu bugs, we know the risk is higher in the parts of the year around the fall and winter. As the weather gets colder, we tend to spend more time indoors in closer contact, sharing space, sharing air. And we know that along with that comes an increased risk of these viruses passing from person to person. So we typically see colds and flu-like illness, influenza itself increase this time of year. We have seen COVID risk increase this time of year, and we should expect this next few months until we get to the warmer spring months to be a high risk period for things like COVID, flu, and RSV.
So can you please explain to me what a respiratory virus is?
Sure. So essentially, all these infections, all these diseases and illnesses that we can get are caused by these microscopic organisms. Viruses are these really small things that circulate and pass from person to person. And when you come into contact with it, because of the way your body interacts with it, it's what causes you to feel ill. Maybe you develop a fever or a cough or a runny nose. And these viruses are able to survive because they pass from person to person. So with these infections, when you're sick, not only are you feeling unwell, but you are at risk of passing that virus on to someone else and making them feel unwell. So that's how it happens in our community, that these things spread.
Okay, and what is the difference between that and things like the cold and flu, COVID-19, RSV, and any others?
So essentially, there are a whole host of different viruses that circulate, and many of them are more common this time of year. So things like influenza, aka the flu, that's a particular set of viruses. COVID-19 is a particular set of strains of a particular virus. RSV is a virus. There are all these different viruses, and some of them cause fairly similar kinds of illness. Things like fever, cough, runny nose, respiratory illness that's more significant. And some of those things we call the common cold, some of those things we call respiratory illness. We have certain labels we apply, but the bottom line is there's a whole host of these different viruses that are all circulating this time of year.
And where would be the best place for people to go to get information on cold and flu, COVID, just to keep up to date with what they should need to know?
So I'm happy to say, from a public health perspective, we have a lot of information on our website, wdgpublichealth.ca. And I know that as part of the Ontario Health Team here in Dufferin County, we have a lot of resources available on our Hills of Headwaters website as well. And I know that if you go to the Headwaters Hospital website, you can also find a lot of information about the services available there and the context of what the hospital is experiencing.
And what would be the role of the Ontario Health Team in all of this?
I'll jump in there. So as Matthew had alluded to, there's information that's coming through from public health, information coming through from the Ontario Health Team, and information coming through Headwaters Healthcare Center as well. What's unique about this year is, unlike the years before, in a new way, we're partnering together to have a coordinated readiness and response as partnering organizations to look at what is, and have a monitor of what is the activity happening in our community, what are the cases, what are the concerns of our frontline workers, what are the concerns of the community, and we come together and we look at ways that we can better educate our local community. So there's always those provincial resources, there's always those larger scale resources that we can absolutely tap into, and we're looking at a very local response around what does our Dufferin residents need, what are they looking for, what questions do they have. We come together and we look to see how we were able to coordinate that response together. So as you see, the three of us here today, our organizations are partnering with us as well as our entire Ontario Health Team Collaborative. With that, I'll give you a little bit of context on what does that mean exactly, right? This Ontario Health Team Collaborative. So what an Ontario Health Team is essentially a collaboration of health and social care organizations who come together to truly look at how we can improve the health and wellness of those that, in our particular circumstances, reside or work in Dufferin and as well as in Caledon. So that could mean a number of things. In this context that we're looking at from a colon flu, a respiratory response perspective, and tapping into the lessons that have been learned over the years that we've gone through. The last couple pandemic years we've had, many lessons learned have happened there. And now we're really tapping into those lessons learned and coming up with a coordinated response with many of our local partners arm in arm working on it and looking at it together. And I will say, even though I say this year we're approaching it in a new way, what's unique about the Dufferin and Caledon communities is really, prior to this, there really was always a coming together of organizations and a coordination and an emphasis on how we can look at to do things better and improve. And so now we're just building on that year over year.
And I think that's really important too. I mean, we did have a couple of years where everything, it almost seemed like everything was new, and we were very reactive, and now it's pushed everybody, and no matter what they do, to be a little bit more proactive in thinking of things. And you're absolutely right. With the Dufferin community, I find it, I'm a very happy resident of Dufferin County because I love the community. I love the support. I love the way that groups will work together in order to better the community, to better responses for things, to react in a way as a community versus there's one organization over here and there's one over here, and we're trying to work together, but we're not quite together. So I do commend the fact that, you know, you've taken this proactive approach and working together, I think is phenomenal. Can you tell me who is most at risk for this cold and flu season?
So in our community, unfortunately, the viruses that are circulating can affect anyone, can cause anyone to become ill, but certainly there are some groups who are at greater risk of needing hospital care, needing their own primary care because of their own individual risk factors. We know particularly these viruses can affect people who are at the extremes of age, either older adults or very young children. People who have medical conditions because they're immunocompromised, they have certain kinds of heart or lung or other disease, can be at higher risk of more severe illness. And as well, we know that certain groups and populations within our community who have historically and currently face barriers to care, people who are racialized, people who are equity deserving, people who identify as Indigenous, for example, those populations, because of a lot of social factors, also experience higher burdens of disease.
Okay. Now, is there any advice you can give us for us to stay a little bit more healthy and hopefully avoid infection?
So I think that what I would reiterate with you today are the things that we as a community have been saying for the past several years of the pandemic and have really emphasized again and again. It is really important that people, maintain an awareness of what's going on around them, keep up to date with information coming from the health team and the hospital and public health about the level of risk in the community. Make sure that you are staying home if you're feeling ill, monitoring your symptoms, and seeking care if you need to access that care. And of course, making sure that you're getting your vaccines. We're fortunate to have vaccines against several of these infectious diseases available in our community. And we do have those available now. And it is important that people come forward to get those vaccines.
And I think I think we all are just more aware of taking care of ourselves and maybe not going into work when we've got the sniffles or we're really not feeling well. Whereas before, people would be like, well, I just need to go to work. It's, you have that responsibility. You've got to get there. And I think now, we're a little bit more aware. I mean, should we, or do we still need to be wearing masks?
So what I'll say is that we're in a different place in the pandemic context where we were a year or two ago. It's not the same kind of response that we have. The threat of the pandemic is different than it was back then. And what we're saying now is that masking is one of the tools that people have in their toolbox, which can reduce their risk. It's certainly something to consider doing as the risk gets higher in our community over the fall and winter months. And maybe particularly important for people who are either themselves at higher risk or those around them are at higher risk. For example, if you're visiting someone in hospital who's acutely ill, you're visiting a friend or relative in a long-term care home, those are settings when it would make sense to wear a mask. You don't have to wear a mask all the time, but there are some select examples of where the risk is higher. In particular, if you're spending time indoors in really tightly packed indoor spaces where you don't have a lot of ability to physically distance and you are, not having good ventilation in the space, those are areas where the COVID risk is higher, and those are also areas you might consider putting a mask on.
And should we be wearing a mask when we go out to Headwaters Healthcare Center?
So currently right now, we have a mask-free or a mask-friendly policy. We want to make sure the hospital experience is safe for everyone who joins. So we're really following what infection rates are within our institution, as well as what's going on in the community. And public health does a great job of monitoring that and making that information available to us. Again, you can ask, we do have masks available, so you can choose to wear it. You can also ask your healthcare provider to wear a mask while providing care. That is readily available. We also have different types of precaution rooms where additional protective equipment is needed, and we have education material to understand how that process works. So, yes.
Wonderful. And can you tell me a little bit about the vaccinations that are available? We just have a couple minutes left, but I want to make sure we get that information out for people that may be interested in knowing.
Sure. So we have actually multiple vaccines available this season. Of course, people are familiar with the flu shot. We have it available every year. Basically, anyone aged 6 months or older can get it, and we do recommend that everyone get it, particularly if they're in those higher risk groups because of their medical history or because of their age, for example. So that continues to be available in public health clinics, primary care, pharmacies, etc. Of course, COVID-19 vaccines are available. We do have an updated vaccine available this season that more closely aligns with the strains of COVID that have been circulating in recent months. We are recommending everyone, again, who's 6 months and up, get that vaccine, even if they've had a vaccine before, as long as it's been about 6 months since their last vaccine dose. And we do actually, for the first time this season, have a vaccine that targets RSV, which is one of these other viruses that circulates and can cause fairly significant illness, particularly in those who are old or very young. It is only a vaccine that's available right now for 60 plus, and it's not available as a free vaccine. It's something that people do have to pay for out of pocket or have insurance coverage for. But if you are an older adult above age 60, it's something that's worth speaking with your physician about to see if it makes sense for you.
Well, I wanted to thank all three of you for joining me today and spreading and creating more awareness for everything that I think affects all of us in the community and of all ages. So I want to thank you all for joining me. And then and I want to thank you for tuning in, but don't you go anywhere. We're going to come back with some respiratory information for seniors. We'll be right back.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Listen, you have a passion for something, so my passion was cooking, and Rogers allowed me to share my passion with everybody. And it is work, it is commitment, but it doesn't feel like it. Right? When you're up there, you're doing it, you're presenting it. Love every minute of it. Absolutely. And I thank Rogers for allowing me to share my passion with the community. Yeah.
Lovely viewers, it's your host of On the Couch, Antoine El-Hashim, reminding you to tune in for every episode of Season 9 of the longest running and most loved local queer talk show on Rogers TV. Check it out.
Welcome back to Dufferin Life. Thank you so much for staying with us. And if you're just tuning in, we're talking about some important information about respiratory health for the fall and winter. And we're going to have a little bit of a look at seniors and things that we can do to help the seniors through this season. So let's start. We've got Dr. Tannenbaum joining us, and we have Stephanie Colson. Thank you so much for staying with us. I think this information is really important to a large part of our community.
Absolutely.
So winter can be especially isolating. Is there something that we can do to help our senior family, friends, and neighbors how to make it through the season and access the help that they may need?
I'll jump in. So one thing that the Ontario Health Team has launched just very recently is Dufferin-Caledon Community Helpline. I'm going to read it off my notes because I don't quite have it written off the top of my head just yet, but it is 1-844-806-3093. And we will be sharing this information far and wide through our social channels linked to the Hills of Headwaters website, as well as through our partnering organizations, our community health and social service organizations in the community, who we've all come together to partner on this health line. A little bit more about that is really help is just a call away. If you have any questions around navigating the healthcare system, what options or resources are available to you, you folks can give that phone number a call. Also, we have through our partners in the through our partners in Dufferin-Caledon through the OHT, we have many services that are available to seniors, and sometimes they just don't know what's there, right? So half the time it's really figuring it out and finding it, and that's a really big part of what the Ontario Health Team is trying to do, is trying to get that access and information out there and making it a little bit easier, if not a lot easier, to navigate for folks. So we have our new navigation line, as well as the promotion of services that we continue to offer in the community.
That's amazing. And where can older adults go for care if they need to speak to somebody personally?
Absolutely. The navigation line will absolutely continue to direct people in that way. But prior to that, over this last year, we've developed a Where to Go campaign. And what that is a one-stop shop resource to know where to go if you're not feeling well. This can be a link to a resource of all the local walk-in clinics, virtual care option. For folks that don't know, there is a virtual urgent care clinic that is available to residents, because sometimes we're not able to drive to Brampton, or we're not able to get to Headwaters for certain areas. And really it's to be able to avoid ensuring that going to the emergency department is really in the incidence of a true emergency, and really looking at what other resources are available for folks to be able to access first, and before they go to the emergency department. So there's a virtual urgent care resource as well, with a link and resources for folks to tap into healthcare that way. We send out this info and a few more resources. What can the pharmacy do, and all kinds of things like that? Because now the pharmacist can prescribe some stuff and walk-in clinics, but what are their hours of operation? There's a virtual resource, right? So when you're in the moment and you're trying to figure out what healthcare resources you need, my son is sick, what do I do? We've tried to make it as easy for folks as possible. So there's this Where to Go resource that's in print and available through our website as well. And that's it.
And I think it's important, which is why I really appreciate the two of you being on and sharing this information and making everybody aware of it. Because I think for some older adults, it can be very confusing and they're very unsure of what they're doing. So, and some of them may not be very tech savvy, and they just don't know where to go. So the first instinct always is to go to Emerge if you kind of reach that point where you're like, I'm not getting any better, this is getting worse, I feel horrible, where do I go? And I think our first instinct, even if you are tech savvy, is like, well, I guess maybe I need to go to the emergency room. So having these resources available is definitely very helpful. So what role does the Ontario Health Team play in the care for our senior adults here in Dufferin?
We do a number of different things. Working with seniors is one of our priority populations. One of the populations of folks that we direct and look at, how can we improve and coordinate care for seniors in Dufferin-Caledon in new and innovative ways. So when we talk about how the structure of an Ontario Health Team works, is really partners coming together to look at what are the gaps, what are the challenges, what are the needs, and brainstorming and coming up with innovative solutions and finding ways to improve that. So some ways it could be how to make navigating home care easier. How can we access home care, and how can home care coordinate better with hospitals, with primary care, connecting all of our different pieces together to have someone not have to tell their story time and time and time again, right? So we have able to have that coordination of care. So that's something that we're really looking at for all, but really honing in on that high needs for seniors right now. Another area is, looking at decreasing the health equity gap, and looking at how we can look at diversity, equity, and inclusion for all when we look at all of these different areas of improvement and apply that into our work, and how that really does truly affect our seniors on a whole other level. And then how can we work to make that healthcare journey a little bit easier for them? So again, as I said, not having to tell their story once, more than once. Are there other ways that we can make that easier? Can we look at transportation? Can we look at getting to those appointments? Those folks that are out there living in more rural areas and accessing services is challenging, right? How do we bring services to you? So these are some of the conversations and areas that we're looking at. And then the most important thing is we're connecting with seniors themselves. So we're talking to seniors, they're involved in the conversations. So it's not just us in a boardroom coming up with all these ideas. We're really asking and reaching out and co-designing some of this work with seniors, with individuals' lived experience. So folks who have had a challenge in the healthcare system, they haven't had a good go. And so we're like, those are the folks we're like, yes, come talk to us. Tell me what that's like. This is what we're working on. What do you think? Do you think this is going to work? So our role is really to bring not only our organizations together in the community to look at any way that we can improve the whole healthcare experience for seniors. Just a couple things.
Just a couple things. Just a few little things that you're working on for sure. And I mean, I know I touched on it. You've touched on a little bit of it as well. But I mean, with seniors, there are people that don't have access to phones, or they're not very comfortable online. How are you reaching out to those particular seniors?
Absolutely. That's one of the things that we've engaged our community with, to say, how are you getting this best? Because we can definitely put all the fancy social media posts out in the world and have a lot of intention around it, but that's not reaching everyone, right? And if folks not quite sure who the Hills of Headwaters Collaborative Ontario Health Team is, they won't know to look for our site to be able to find the resources, right? So it's a little bit of sharing about who we are, which is part one, but really it's just getting the information out there. So our team has been a lot more boots on the ground. Walk-in clinics are starting to get to know my name. I'm kind of banging down their doors and saying, hi, I have another resource for you. Hello, I have another resource. Printed, copies in hand. We're going to events, we're meeting people. I think the biggest thing is integrating with the community. So getting to know who are our best community stakeholders to spread the word and share the resources. So print is one, and social media is another, and on all the online resources. But really, it's just spending time and getting out there and getting to know folks. Having lovely conversations such as this, and sharing about a little bit more about who we are and what resources, because we're really starting to come up with some pretty exciting stuff to help folks in the community. So, yeah.
That's amazing. So will the older adults of the community, will they take priority in vaccination?
So yes, older adults have been and will continue to be prioritized for vaccination over the course of the entire season. We know, unfortunately, that older adults are at higher risk if they get COVID or flu or RSV or one of these other viruses. They're at higher risk of having to go to a hospital or having more severe illness. So we have always prioritized them through the vaccine campaign as a community. When we in our community got our very first doses of COVID vaccine this fall, they went, into our offices and immediately out to our long-term care homes, where we know the burden of things like COVID has been really, really, really hard on people and where the risk is really, really high. And from there on, we just continue to focus on, as we get supply, as we have capacity in the community to deliver vaccines to people's arms, we are really emphasizing where we can the people who are at highest risk, reaching out to them, making sure they have appointments, and making sure they know what they need to do to stay safe this season.
And how can they book their immunization?
So we're fortunate in our community to have a lot of places that you can go to get things like your COVID or your flu vaccine. You can go to your family doctor. They all have been ordering from us these vaccines and are giving them in their offices in many cases. We have places like pharmacies you can go to. They're able to deliver multiple of these vaccines, and you can go to your own pharmacy or other pharmacies that are convenient for you. In public health, we're running clinics to make sure people can access vaccines through us if they have nowhere else to go. There are a whole bunch of different channels that exist in our community. We really want to take an approach of there being no wrong door and to make it as easy as possible for you to get these vaccines in the places that you're already going to get your health care.
And I mean, we've just got about a minute or so left, and I wanted to put this out there and ask you. I mean, there are people I'm assuming that may still be hesitant about having a vaccination done. Is there any advice or anything that you can tell them a little bit of, to encourage them about the possibility of possibly having an immunization?
So, people have heard a lot from us and from others in the community about COVID vaccines over the past number of years, and people may have hesitation around that, or even hesitation or ambivalence about the other vaccines that are out there. What we've really tried to emphasize is that these are vaccines that we know well, we understand the science behind them, we know how effective they can be, how dramatically they can reduce things like your risk of dying from an infectious disease, your risk of going to hospital. These vaccines do really, really make a difference. And as we try to emphasize those benefits, we also really focus on how do we make it as easy as possible to get the vaccine. Some of the reluctance isn't so much about not understanding or not believing in the value of the vaccine, but it's about, do I want to spend so much time out of my day or my week to go and make multiple appointments to get this vaccine and that vaccine? Because people are busy and they have other priorities. So we have been working with all the providers in our community as a health team and as public health to make sure they have the latest information. Vaccines are available in multiple different settings. People know about how to give them, the fact that you can give multiple vaccines in a single visit so you can get everything done efficiently and to make it easy as possible for patients and people in our community. We really are focusing now on making the patient experience around vaccines as easy and as pleasant as possible, because we know that as much as we talk about it, people have other priorities too.
Absolutely. And I want to thank you both for sharing, and Alex that was here earlier sharing all this valuable information. Thank you so much for joining us today. And thank you for joining us. And until next time, bye-bye for now.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Think it's okay to drive high? Think again. Drug-impaired driving is as illegal as drunk driving, and in Ontario, the penalties are the same. If police suspect you're driving under the influence of drugs of any kind, or a combination of drugs and alcohol, and you fail a roadside test, your license will be suspended immediately for up to 30 days. You'll pay a